Hello everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video. In this video, we're going to be talking about knock knees. What exercises can you do? So firstly, we need to understand what are knock knees. So your knee is a joint made up of three bones. The thigh bone, right? This is the thigh bone, the leg bone, and there's something called the kneecap in the center. These bones are aligned in a particular way, right? They're aligned in a way so that a line connecting the center of the hip bone to the center of the ankle can either pass through the center of the knee, can pass through the inner side of the knee, or could pass through the outer side of the knee. When it passes through the center of the knee, it's a straight knee, which is perfect. When it's like this, like a bow, it's called bow knees or Genu. When it's like this, that means the knees touch against each other. When you try to stand at attention, we call it knock knees. That means all the body weight goes through the outer part of your knee. Now, God doesn't make all of us perfect, right? There's always a gentle variation between both. You could have a degree or two of bow legs, of Genu Valgum, which is considered within the realms of normal. When it's more than that, it is called a pathological alignment. So it could either be bow legs or knock knees. Knock knees is when there's excessive body weight going through the outer part of the joint, and when both knees strike or touch against each other when you try to stand at attention. That means you can't put your ankles together, your knees touch. This is knock knees. So what's the problem in this? When all the weight goes through the outer side of the joint, remember, your joint is like a table. If the legs of your table are not straight and all the stuff is put on the side where it's a little crooked, what will happen? The table will collapse on that side. So when all the body weight is going through one part of the joint, what happens is the cartilage on that part starts going away and starts getting rubbed off. Now, what is this cartilage? Cartilage is a polish that God has put on both the surfaces of the knee, the thigh and the leg bone, as well as the kneecap. The job of the cartilage is to provide a smooth surface so that there's no friction in movement. Because why is the cartilage there? To have a smooth movement between bones. So what happens in knock knees is because all the load is through one side, the cartilage gets rubbed off there and the chances of arthritis are higher. So what do you do in this situation? So if it's a degree or two, you could just leave it, right? Nothing to worry. Exercises for your thigh bones, for your thigh muscles, for your leg muscles, for your lower back will help your body cope with that particular posture. So you can focus on quadriceps exercises, that is the thigh muscle exercises in front, hip abductors and external rotators. These are muscles that compensate for the knee joint. What are the abductors and external rotators? These are the muscles that help take your leg away from the other leg. So lie on one side, lift your leg up, keep it up for 10 seconds, come back down with your knee straight. That is hip abductors. External rotators are butterfly pose. Right? You lie down with both your feet together and move your knees outwards and inwards like a butterfly. Quadriceps exercises are exercises where you straighten your knee, tighten your kneecap, keep it tightened. That helps. Exercises like cycling, swimming, the cross trainer, the stepper are great for your thigh muscles and they help compensate. Is it going to change the shape of your joint? No. This is going to help reduce the chances of arthritis later on. And of course, controlling your weight. Now, understanding why this happens. So why does knock knees happen? Number one is genetic. If you see your mum, dad, you see that their knees touch against each other, chances are you'd have it. Certain races have more of it, like Caucasians and the African race has a higher incidence of knock knees than, let's say, the Asians who have a lesser, and the South Asians, Southeast Asians that have a lesser incidence. There they have more bow knees, you have bow legs, and the Caucasians and Africans have more knock knees. The other very important reason, and especially with the advent of COVID, which was an epidemic at that stage, was vitamin D deficiency. So vitamin D helps in your body absorbing or taking in calcium. Calcium are the building blocks of your bone. And when you're growing, if calcium storage is not good in the bones get weak. When they get weak, their shape can change. So one of the biggest reasons for knock knees was vitamin D deficiency, rickets in children, which lead to knock knees. 3 is certain types of injuries. So if you've had an injury to the knee, to the thigh bone, etc., the fracture did not heal in the right position, it could lead to knock knees. I hope you've understood quite a bit about knock knees, why do they happen, what exercises you could do, etc. We'll also talk about the treatment. Remember, the shape of bones after somebody has attained adulthood cannot be changed. Sometimes knock knees can be physiological. That means till the child is about 6 years old, 7 years old, it passes through a phase of bow legs to straight knees to knock knees to straight again. So don't worry. However, if it's persisted over 7 years, then something needs to be done. Bracing, etc. may be tried in certain people. However, it hasn't been shown to be very effective. If there's knock knees beyond 7 to 8 years of age, then something would need to be done if it is pathological later on. What do? You do something called osteotomies. That means you crack the bone, realign it, and get it out straight. The two ways I do it, one is a cosmetic technique in adolescents, that is kids that have grown adequately well, an inch or two less than their maximum height, but are still adolescents, teenagers, about till the age of 14 in girls and about 16, 17 in boys. Through a small little nick, I crack the bone, get it out straight, put a plaster. It's cosmetic, no cuts, etc. Very small single stitch. Very effective, but should be done in specialist hands. The other is usually done in adults, wherein you crack the bone, you straighten the bone, and you put in a little plate. Here the mobilization is quick. You can't put weight for about 6 weeks to 8 weeks in both these operations. But in the plate operation, the patient can bend the knee. This is also a specialist operation that I specialize in. This is to straighten the knee so that the body weight goes through where it should go. I hope you've understood a lot about knock knees, the treatment, why does it happen. If you like my video, please like and subscribe to my channel, and please follow me on Instagram. Thank you.